Hey, everybody out in Maryland's 8th District. I get to introduce you today to Deanna Najera, who is our local hero for today, May 29th, this final local hero of May going into June. This is always my favorite time of the week, as we get to celebrate the people who are getting us through this terrible public health, economic, and social crisis that we're living through. And Deanna grew up in Frederick County. She lives in Carroll County. She is the president of the Maryland State Physicians Assistant Academy. She's a big champion for the PAs, for the physician assistants, and she's really been in the front lines of this crisis in so many different ways, including working at the Pleasant View Nursing Home, which was one of the early hotspots where we saw an outbreak of COVID-19. Welcome, Deanna. Congratulations on being this week's local hero.
Thank you so much. This is really an honor. I appreciate it.
Well, we're delighted to be with you. You got to tell people what physician's assistants do, and what do you do as kind of the leader of the PAs?
Sure. So PAs have been around for over 50 years, and our origin of our profession is from military medics. And so we have a strong tie to the military, so I really appreciate this week as being a way to highlight PAs. And one of the other things is that our profession was created to improve access to care, to get care to the people that didn't have physicians in their area or didn't have access to providers. So we were made for exactly this type of setting where, we've had to pivot in our roles. Everybody's being asked to do things they've never had to do before. And from the Maryland Academy of PAs, we've been supporting PAs in doing telemedicine and navigating new insurance loopholes, but also redeployment within hospital systems. We are trained as generalists. So we have the opportunity to work in a variety of healthcare settings. We're staffing the surge centers at the state and local levels. Colleagues have been deployed to New York City and other hotspots across the country. But we're also just doing things like calling our patients every day to check in and see how they're doing, and delivering food and other home services. And one of the things we can thank you for, Congressman, is passing the Home Health Care Act as a component of the CARES Act, because now we can order those home services for our homebound patients and, again, improve their access to care.
You were an emergency room PA before all of this started. Do you still do emergency room work, or have you been redeployed to the COVID-19 hotspots?
So that's one of those interesting things, is that Maryland has done such an incredibly good job of putting social distancing and masks and all these other things that are hard, but we've done such a great job that we've stopped COVID from boiling over in the state. So we've reduced it to a simmer, which is a lot harder to navigate and will require a lot longer sort of battle, but that means our volumes in our hospital systems are much lower than we expected. So I had the opportunity to help out our local health department, and I jumped at it. And I have to say, I'm in awe of the individuals working here. They are truly unsung heroes in public health. Even before the pandemic, the amount of services and the variety of things that they were doing for residents of the county and the state at large. And now with the COVID response, again, they're all doing things outside of their normal realm and in such an incredible way and heartless way.
I'm sorry, are you referring to the PAs there, or are you talking about people at the public health department?
All of the public health department, the nurses, the staff, everybody. I mean, they're just putting their heart and soul into this and dedicating so many hours in the response and helping keep people safe. Yeah.
It must continue to be very stressful work for people.
Yeah, and I think not having an end date is really hard. And when we talk about disaster management, the disaster usually has already happened, but this is almost like a hurricane watch every single day. We keep saying it's going to hit, and it's not hitting because we're doing such a good job. We're masking up Maryland, and we're wearing our masks and protecting ourselves and our communities, and that's what we have to keep doing. And it's just hard not to have an end in sight.
Yeah, just tell us what it was like when you went to the Pleasant View Nursing Home. I think you were part of the first expeditionary force that went in to see what was going on there.
Sure. So it was actually myself and the health officer, and we did a walkthrough to just sort of see what things were in place and what sort of making sure guidelines were being followed. And the staff was really working hard. They care a lot about their residents, and that's true of every long-term care facility. They view them as family, and they're bending over backwards to try and keep them safe and keep their staff safe. And so we went through and we're kind of trying to make sure that they were mitigating any kind of risk to their residents. But then the weekend after we visited is when a lot of the people started to get very ill, and the testing started to become more accessible, and we were learning that all these people were positive for COVID.
Cool. Well, look, as the local hero, you get to give us a parting message. What would you tell people about getting through the crisis and how we're going to finally emerge from this nightmare?
I think doing what we're doing, it's hard to keep the path, but, continuing what we're doing. And from a PA perspective, allowing us to continue to practice to the full extent of our license. We practice medicine alongside fantastic physicians and advanced practice nurses, and we don't want to see patients going without care because of unintended barriers. So letting us visit with patients through telemedicine or in person and having the PPE that we need to keep ourselves safe, to keep you safe, so that we can be there for you today and tomorrow and next year.
All right, Deanna Najera, you are a true inspiration, and everybody in Maryland's 8th District salutes you. You are our local hero. Keep up the great work and stay in touch with us.
Thank you. Thank you for all that you're doing for us. We appreciate it.